Long time no see. This is YouTube Medical University. All blood test items are normal. The main markers are also within the standard range. Doctor, I'm relieved. There was a man in his 60s who left with a smile like that. 3 months later, pancreatic cancer was found, and it was already stage 4. This isn't a made-up story, it's something that can actually happen. When I'm seeing outpatients, I really do think this sometimes. Why didn't they come in sooner? If only they had come in when they noticed that red lump on their shin, the change in urine color, or the throat symptoms. If they had thought even one of those things was strange and sought medical attention, the outcome might have been different. Pancreatic cancer is sometimes called the king of cancers. By the time it's discovered, it's often already too late. That's the case for the overwhelming majority of people. However, the body does send out warning signs of pancreatic cancer. Moreover, those SOS signals appear in places where most people would never suspect the pancreas. In today's lesson, we'll look at the latest research data from Oxford University. Based on large-scale data from over 24,000 people, I will introduce 5 SOS signals that the body sends out for pancreatic cancer. Especially the third sign might apply to some of you right now. In the latter half of the video, I will also introduce specific actions you can take. Please be sure to listen until the end. Whether you know this today or not could change your future. Here is today's agenda. In the first section, we'll discuss why pancreatic cancer is considered the most formidable. Why is it often missed in blood tests? In the second period, we'll discuss 5 SOS signals of pancreatic cancer. In the third period, we'll discuss an action plan to detect pancreatic cancer early that you can start today. I want everyone to know something first. Pancreatic cancer is unique among cancers. It's unique in a bad way. The 5-year survival rate is about 13% for colon cancer, it's about 70%. And for stomach cancer, it's about 65%. Only pancreatic cancer is in a completely different league. But this is the most important point. People who are diagnosed early versus those who are diagnosed after it has progressed. The difference in 5-year survival rates is more than 20 times. In other words, with pancreatic cancer, everything is determined at the stage when it's found. If it's detected early, there's a good chance of survival. So why is it so hard to detect? Well, there are 2 reasons. First, the location. The pancreas is located deep inside the abdomen. It's behind the stomach, in front of the spine. To use an analogy, it's like the pipes hidden behind the walls in a house. You often don't notice a water leak until the wallpaper falls apart. Pancreatic cancer is similar. By the time symptoms appear on the surface, it has often already progressed. And secondly, this is the most important thing I want to tell you today. It can be missed in blood tests. Everyone, do you get a health checkup every year? Many of you probably also add tumor marker testing as an option. The typical tumor marker for pancreatic cancer is called CA19-9, but for this test, when pancreatic cancer is 2 centimeters or less, in other words, in the early stages, the positive rate is only 52%. Half of the people have pancreatic cancer. But the results come out as normal. It's the same probability as flipping a coin. If you toss a coin and it lands heads, it's cancer. If it lands tails, it's missed. To put it bluntly, that's the level of this test. There's one more thing you should know. About 10% of Japanese people, 1 in 10, don't have elevated CA19-9 levels due to their body type. In other words, even if they have pancreatic cancer, their tumor markers will always remain normal. Isn't that surprising? So every year they pay several thousand or even tens of thousands of yen to have their tumor markers measured, are told everything is normal and safe, and then go home. But that test might be missing pancreatic cancer. Of course, I'm not saying that tumor markers are completely meaningless. In advanced pancreatic cancer, the positive rate for CA19-9 is about 70 to 80%. It's not a useless test. However, just because your tumor markers are normal doesn't mean you're fine. Please throw away that way of thinking right now at this very moment. So what should you rely on then? That's your body's SOS signal. There are various tumor markers, but I've talked about their effectiveness in a previous video. If you're interested, please check it out from the description after this. Pancreatic cancer may be able to hide in blood tests, but it can't fool the whole body. It can cause unexpected symptoms in places like your legs, skin, or throat. In the second part, using the latest data, I'll present the 5 warning signs of pancreatic cancer. After hearing this much, if you're wondering, can it be detected with a blood test? Please subscribe to the channel and enroll before you forget your surprise. At YouTube Medical University, we deliver life-saving knowledge like this every week just by knowing it. If you found this helpful, I'd appreciate it if you could also hit the like button. And there's one more announcement. I've created a PDF document that summarizes today's content on a single A4 page. It contains the 5 SOS signs of pancreatic cancer and a self-checklist. You can stick it on your refrigerator and check it anytime at a glance. Register on the official line via the link in the description and send Suizu in Hiragana. It's free and delivered instantly. Now, let's move on to the second period. This is the main topic. From here, I'll introduce 5 SOS signals that pancreatic cancer sends out in your body in a ranking format. The 5 signs I'm about to introduce are things that most people would never suspect to be pancreatic cancer. That's exactly why they're often overlooked. That's why it's worth knowing about them. So, let's get started. The 5 SOS signals of pancreatic cancer. Number 5, pain from your back to your lower back. This is a relatively well-known sign. However, because it's well-known, there's a pitfall. When pancreatic cancer causes back pain, there is a certain characteristic. It gets worse after eating. It feels better when you lean forward, and you wake up at night because of the pain. Why is that? The pancreas is located right in front of the spine. When a tumor in the pancreas grows, it presses on the nerves around the spine. So when you lie on your back, the pressure increases and the pain gets worse. When you lean forward, the pancreas moves away from the spine, making you more comfortable. However, many people think it might be back pain or just due to aging, so they go to an orthopedic clinic. They get an x-ray, are told there's nothing wrong with their bones, and go home with a pain relief patch. Let me say it again. Back pain that gets worse after eating. Back pain that changes with posture. This might not be a bone problem, but rather an internal organ issue. If any of this sounds familiar, consider consulting an internal medicine or gastroenterology department or your regular hospital. Please think about discussing it with them. Here is number 4. Swelling in the legs. Especially when only one leg swells. Swelling in the legs is something that happens often, right? It's true that swelling can occur after standing for long periods or from consuming too much salt. However, if only one leg suddenly swells, is painful, and becomes red, this could be a condition called deep vein thrombosis, or DVT. It's a blood clot that forms in the deep veins of the leg. That clot blocks blood flow and causes the leg to swell up. This is DVT. Why is this related to pancreatic cancer? Pancreatic cancer releases substances that make the blood more likely to clot. This phenomenon is technically called Trousseau's syndrome. In fact, this phenomenon was first reported in 1865 by a French doctor, Dr. Trousseau. That was more than 160 years ago. Even though it's been known for that long, many people still don't know about it. Let's look at the data. There are reports that about 12 to 36% of pancreatic cancer patients develop thrombosis, in other words, blood clots. This is one of the highest risks among all types of cancer. In other words, that's what it means. Recently, if only one leg suddenly becomes swollen, your leg hurts unusually, or it turns red, most people go to a vascular surgeon or a dermatologist when they have these symptoms. So if a blood clot is found and treated, it's important not to just stop there, but to also have the cause investigated. Pancreatic cancer caused the blood clot. Things like this can happen. Here's number 3. Sudden diabetes. This is where it really gets important. After turning 50, you were suddenly diagnosed with diabetes. No one in my family has diabetes. I haven't gained any significant weight either, and yet my blood sugar levels suddenly started to rise rapidly. People like this need to be especially careful. According to a large-scale study in the United States, about 25% of people diagnosed with pancreatic cancer develop type 2 diabetes within 3 years before their cancer diagnosis. The reason is that the pancreas is the organ that produces insulin. Insulin is the hormone that lowers blood sugar levels. In other words, when cancer develops in the pancreas, the factory that produces insulin is damaged. As a result, blood sugar becomes harder to control. If you're over 50, have no family history of diabetes, and are not overweight but suddenly develop diabetes, this pattern makes it more likely that pancreatic cancer is present. I'm not saying this applies to everyone. Many people who develop diabetes after the age of 50 have causes other than cancer. It could be due to genetics or lifestyle habits. However, there is data showing that people who develop diabetes after the age of 50 have about 8 times higher risk compared to the general population. It's worth knowing this fact. If you think this might apply to you, please consult your primary doctor about getting a pancreatic imaging test along with your diabetes treatment. Now, let's move on to number 2. The second sign is changes in the skin. This is probably a sign that many people would be surprised by. First, let me explain the first point. On the shin or around the ankle, you may develop a red, hard lump, and when you touch it, it hurts. If you leave it untreated, the lump may break open and an oily, brownish fluid may come out. This is technically called pancreatic fat necrosis. So what's actually happening here? The pancreas is damaged by pancreatic cancer, and an enzyme called lipase, which is produced by the pancreas, a digestive enzyme that breaks down fat, leaks out in large amounts into the bloodstream. This lipase circulates throughout the body and, believe it or not, dissolves the fat under the skin. It's like drain cleaner flowing backward into the pipes and causing them to dissolve in various places. That's the kind of situation we're talking about. Even if you go to a dermatologist, there are cases where they say the cause is unknown. That's because it's not a skin disease. The cause is the pancreas. You might develop mysterious red lumps on your shins. It's difficult to suspect pancreatic cancer based on just this, but if there are no other causes, or if you have symptoms like loss of appetite or weight loss, it would be worth having your pancreas examined. And there's one more symptom. The skin on the back of your neck, under your arms, or around your groin suddenly becomes darkened. The texture has become rough. This is also a skin change that can be caused by pancreatic cancer. Medically, it's called acanthosis nigricans. This change occurs because growth factors secreted by cancer cells cause the skin cells to proliferate abnormally. This symptom can also occur in cases of obesity or insulin resistance, so it doesn't necessarily mean it's pancreatic cancer. However, if it progresses rapidly, or if you experience weight loss or loss of appetite, if you have those kinds of symptoms, a thorough examination for cancer may be necessary. The skin is like a bulletin board for the body. It displays internal changes on the outside. Please make sure not to miss those messages. Number 1 is this: thirst and dark urine. Lately, you feel unusually thirsty. When you go to the bathroom, your urine is unusually dark. Just these simple signs could be the initial symptoms of pancreatic cancer. This was revealed in the largest study to date on cancer symptoms, published by the University of Oxford in the UK. The data is based on about 24,000 people in England who were diagnosed with pancreatic cancer between 2000 and 2017. In this study, 23 symptoms related to pancreatic cancer were identified. Among them, 2 newly discovered symptoms were found: unusual thirst and dark urine. Why does unusual thirst occur? One reason is its connection to diabetes, which I mentioned earlier. Pancreatic cancer disrupts insulin secretion, causing blood sugar levels to rise. When blood sugar levels rise, a lot of urine is excreted from the body due to osmotic pressure. To compensate for this, your body becomes thirsty and you want to drink more and more water. And why does urine become darker? When pancreatic cancer presses on a nearby duct called the bile duct, it becomes difficult for a substance called bilirubin to be excreted. As a result, the bilirubin that can no longer be excreted in the stool circulates in the blood and is expelled from the body as urine, causing the brown pigment from the stool to mix into the urine. That's why you end up with dark-colored urine. Sometimes your urine may look like the color of tea or cola. And there's another important thing we've learned from this study. Many people who were diagnosed with pancreatic cancer had some symptoms as early as a year before their diagnosis. And clear warning signs appeared 3 months before the diagnosis. In other words, looking back, the body had been sending SOS signals all along. On average, even a year before. I've been feeling thirsty lately. My urine has been unusually dark. If you're feeling this way right now, take a moment to consider whether it's just age, dehydration, or maybe an SOS signal from your body. Now let's move on to part 3. So, what should you do? I'll share a specific action plan with you. I think many of you might be feeling scared after hearing all of this. It's okay. The fact that you feel scared is actually the first step. If you don't know, you can't take action. Now that you know, you can act. From here, I'll explain how you should act, divided into 3 levels. Level 1 is a self-check you can do right away. The 5 SOS signs I shared today. Check if any of them apply to you. First, does it get worse after eating? Do you have any back or lower back pain? Do you have sudden swelling, pain, or redness in just one leg? Third, have you recently experienced a sudden increase in blood sugar or been diagnosed with diabetes? Fourth, do you have any unexplained red lumps on your shins or ankles? Do you have any sudden darkening of the skin on your neck or underarms? Fifth, do you have unexplained thirst or any changes in urine color? If any of these apply to you, please proceed to the next step. Level 2 is a guideline for when to consult your primary care doctor. If any of the following apply to you, please consider consulting your primary care doctor. First, if any of the previous self-check items apply to you, and you also have symptoms such as weight loss or loss of appetite. Second, if you are over 50 years old and have recently been diagnosed with diabetes. Third, if you have developed unexplained blood clots. Fourth, if you have jaundice, meaning the whites of your eyes turn yellow or your skin appears yellow. Some of you might wonder if it's okay to go to the hospital for something like this. It's perfectly fine. In fact, you should go. If you come early, the outcome might be different. We doctors want to reduce the number of cases we regret like that as much as possible, so please don't hesitate. And finally, at level 3, I'll introduce how to choose the right tests. There are several types of tests for the pancreas. First, abdominal ultrasound. This is what we call an ultrasound. It's not hard on the body and is usually the first test considered. You can even get it as an option during a health checkup. However, since the pancreas is located deep inside the body, it's often hard to see on ultrasound. If you want to examine it in more detail, there's a contrast-enhanced CT scan. By using a drug called a contrast agent, you go into the CT scanner in that state, and it clearly shows the pancreas. And there's also a test called MRCP. This uses MRI to closely examine the ducts inside the pancreas, called the pancreatic ducts. Even in the pancreatic duct clinical guidelines, MRI-based examinations are recommended for people at high risk. By the way, these are the risk factors for pancreatic cancer: having a family member with pancreatic cancer, having been diagnosed with chronic pancreatitis, smoking, having diabetes, especially if it was recently diagnosed, or being obese. People with these conditions need to be more careful about pancreatic cancer. In studies targeting people with a genetic risk for pancreatic cancer, it has been reported that those who underwent regular detailed examinations had a higher 5-year survival rate. In other words, for people at high risk, it is important to undergo regular checkups. First, please consult your primary care doctor and ask, should I get my pancreas checked? If so, what should I do? Here is a summary of today's lesson. First, pancreatic cancer is the most feared cancer. However, if it is detected early, the survival rate increases more than 20-fold. Second, the main blood test marker CA19-9 misses half of early pancreatic cancers. 10% of Japanese people do not show elevated levels in the first place. Third, pancreatic cancer sends warning signs through your body: back pain, blood clots in the legs, sudden diabetes, skin changes, thirst, dark urine. Fourth, do a self-check, consult your primary care doctor, and consider getting imaging tests. These 3 steps are the key to early detection. Finally, pancreatic cancer is certainly a scary disease, but knowing about it is the best prevention. If you've watched this video, you've already taken a step forward. Please let me know your thoughts in the comments section. Whether it's, I'll make a hospital appointment tomorrow, I'll share this with my family, or even, today was the first time I learned about pancreatic cancer. Your declarations and comments might encourage others. Well then, that concludes today's lesson. Take care of yourself. See you in the next video. As a general practitioner, my patients have taught me how to live agelessly after 70. I want to do the same. I never knew life could be like this, full of stories I've heard from my patients. Chatting with friends is more important than exercise, and when it comes to medicine, less is often better than more. This is packed with wisdom from my elders on how to live a healthy and happy life at any age. Please check it out from the description below.